everybody. My name is Grace Howell. I'm a third year medical student at the University of Mississippi Medical Center here in Jackson, Mississippi. I joined the Southern Medical Association last year in hopes to learn more, about the realities and differences that come with training to practice medicine in the South specifically. And I recently joined the SMA Physician in Training Subcommittee, where we're all kind of given the opportunity to put out different interesting or pertinent media for the enjoyment and education of our members of the SMA. So I have with me here today Dr. Brian Williams. He's a physician in the Preventive Medicine department here at UMC. We're so excited to have Dr. Williams here to visit. He's going to visit a little bit about his career path in preventive medicine, as well as, the importance of medical student education regarding the realms of preventive medicine and the social determinants of health. So, Dr. Williams, we're so happy to have you here today with us. Thank you so much for joining us.
Sure, Grace. I'm glad to be here. Thank you so much.
Yay. So we'll just jump right into questions if you don't mind. Dr. Williams, so we'd love to hear a little bit about yourself, maybe, where you went to college, where you went to medical school, how was the different states you lived in compared to, Mississippi and other southern states, what brought you to the South, etc.
Yeah, sounds good. I'm from Mississippi. I grew up in Meridian. Um, no physicians in my family, but my mom is a nurse. And so when I was really young, I would sort of go to her medical clinic and see patients. She did dialysis. So it was sort of sad to see the patients on dialysis. And I never imagined that my career would come full circle and work in a department and in school of population health. It's named for Dr. John Bauer, who was a preeminent nephrologist in the state and really helped sort of found the dialysis program in the state of Mississippi. So I think that's quite interesting. But I, I wanted to go to medical school from a young age. I went to Millsaps College in Jackson. It's a small liberal arts school. And I thought that I would get a good pre-medical education there. And I think I did. And then I started medical school at the University of Mississippi Medical Center in Jackson, where I finished in 2003. And at that point, I moved to Colorado to continue my medical training in family medicine. And I always saw family medicine as my chosen path because I really imagined that would make me a real doctor, right? So I always thought I wanted to be a real doctor, the person who could answer any kind of question for a friend or family member, somebody at the ball game who asks you about their kid's problem. And I just thought that was a great way to serve my community. And what I learned in my residency training and subsequent practice, which was about 10 years in total, I just didn't feel like I was making enough of a difference in the lives of my patients. And it was very frustrating to go to work and to see the same people, month after month, and they really weren't changing their behaviors. They really weren't, improving their health. And, some of that I certainly put on myself, but a lot of it I just blamed the patient. And I just assumed that they just weren't willing or able to make the changes I had recommended. And it really took me a long time to understand that a lot of the reasons our patients don't do the things we ask them to do are because of barriers that are really a lot of which are outside of their control. So I certainly wouldn't have thought that way when I was a medical student. And even early in my practice. And it really took me a long time to come around to understanding that how people interact with the medical system and what keeps people healthy often have very little to do with what the doctors and the nurses and the pharmacists really say. And that's kind of what led me on my journey to where I am now in preventive medicine.
Absolutely. I always love hearing your story. It's so inspiring and it's just so great for us to be able to talk about, your path and how important it is that other medical students are, educated on this early. So what would you say? I guess you kind of already touched on what drew you to public health and preventive medicine. Do you want to talk about what your personal definition of preventive medicine is in public health or health literacy even?
Sure. Yeah. I mean, good segue because that's what got me here, honestly. So while I was in family medicine practice, one of the things that I noticed again and again is that patients really didn't understand what we had told them. They would, one of the clinics I worked in, their main practice was to send letters to patients to explain lab findings or x-ray results or reminders even about appointments or other referrals. And so often patients would come back to me and say they didn't get it or they didn't understand or nobody told them what to do. And it really led me to ask myself, okay, well, what are we not doing that's connecting the dots for these patients? And so that sort of took me down the path of investigating health literacy. I didn't really know that to be a particular entity or term. And you mentioned social determinants of health. I think when I graduated from medical school, I had never heard that term. I mean, it was probably around, I just wasn't paying attention. And health literacy is certainly a component of one of the social determinants of health. I mean, it's not the only one, but really health literacy was what got me to where I am. And so I embarked on a project through a fellowship I did in faculty development. I really wanted to be a better teacher, and a better medical educator. I had had the opportunity in my practices to work with medical students and residents, and I reflected a lot about the things I hated about my own medical training, whether it was medical school or residency. And I said I wanted to make that better for other people. And so, in the process of doing a fellowship in faculty development, I've um, discovered that that fellowship was funded in part by something called the Healthy People 2020 Initiative, which
Yeah.
I didn't know about. And now we've moved on. I'm dating myself because now we've blown past Healthy People 2020 and we've moved on to Healthy People 2030.
Yes.
Um, then discovering what those Healthy People 2020 initiatives were, it sort of led me down the rabbit hole of public health and preventive services. And again, as someone who had practiced as a family physician, I certainly knew a lot about prevention and recommending preventive services to individuals, but I really hadn't given any thought to the prevention of disease on the community level. And so, part of my brain was thinking about health literacy and how we might do a better job of educating our patients and bringing them around to understanding why what we wanted them to do was so important, while at the same time starting to think about my own career and the pathway, and that perhaps some of the frustrations that I had had in practicing primary care really had more to do with the fact that it was difficult to get my patients the help that they really needed and to start understanding some of those systematic barriers that our system is so good at putting in front of our patients. And so really my health literacy journey is what drew me into public health. And so I got my master's in public health at the University of Colorado. And in my search for finding a way to get my master's of public health paid for, I discovered that one of the ways to do that was through residency training in what's called occupational and environmental medicine. And the environmental medicine component of that was very attractive to me because it's the idea that the environment that we live and work in has a lot of influence over our health. So whether that's, wildfires contributing to heart attacks and exacerbations of people's COPD, or asthma rates being higher in kids who live near freeways and things like that. Again, started making me think, this is a broad discipline. It's something that it really impacts people on an individual level, but you have to intervene at the community level because people aren't necessarily in charge of whether their air quality is bad because of wildfires. So then that led me to sort of thinking, how do we go a further step back and a further step back and a further step back and really try to get to the root of the problem? And that's where I think that public health and preventive medicine lies. So, we take for granted now that we have relatively clean air and clean water and things like that, but that wasn't always the case. And that took a lot of policy change. And now I feel like we've gotten a lot of the low hanging fruit and there's more challenging policy dilemmas ahead of us. And there's actually, ways that we could improve health, but we just haven't had the will or I won't say we don't have the money because we pour lots of money into our healthcare system, but we probably just haven't had the will to make some of the changes that we need to make. And so that's honestly how I decided to get myself into public health. And so occupational and environmental medicine is a preventive medicine field. And then when I made the decision, my wife, who's also a physician, we decided to move back to Mississippi because I just thought we would make more of an impact than we were making in Colorado. Um, there was an opening in the Department of Preventive Medicine, and I said, that sounds really interesting to me. And so that's what landed me back in Mississippi, and that's what planted me in the Department of Preventive Medicine. And I've been fortunate enough to be a part of a department that's very engaging and has opportunities to teach residents and medical students. And so that's what I see my calling.
Yes, and it's so interesting that you say, Colorado versus Mississippi, and you felt that you could make more of a difference in Mississippi because I feel like it's just the South has always been put down because we have the lowest health literacy, the lowest this, that, and other stats for diabetes and all these things. So we
Sure.
really, really need, and you felt that gap as a young person, and it's so interesting to hear that. So let's see what's next. So we talked about the social determinants of health a little bit and the impacts in the South. What are some projects that you're currently working on and or if you would like to run us through like a day in your life type thing?
Sure. Yeah, so quite a few projects I'm working on. In fact, when I left the University of Colorado, I didn't leave completely because they still buy back a little bit of my time. And one of the things that I'm doing there is I'm still working on a project that I started. Now it's been almost 3 years ago, and that project was really working on helping cancer survivors stay in the workplace. So, as I mentioned, my original training in preventive medicine was occupational and environmental medicine. And so the occupational component of that has a lot to do with, how the environment of work impacts your health. And work is a social determinant of health. So people's job has a lot to do with how healthy they are. I mean, forget about the fact that in the United States, most working age adults get their health care from their job. But this is literally like, what's the work environment like? So here we weren't looking at people who were had a work related cancer necessarily, but we were looking at people who had cancer of any type who were simply trying to stay in the workforce. And a lot of it has to do with the need to work because of income and support from things like your health insurance, as I mentioned, but just the fact that work is such a social structure and it gives people a sense of purpose. And so more and more cancer therapy is done on the outpatient basis. The therapies are better and better. People have fewer and fewer side effects, and they're really able to live much more normal lives than people once did. And so our project is working with a large oncology group at the University of Colorado to say, can we use occupational medicine as consultants to help people with workplace accommodations and keep them in the workplace, more fully, where in the past, someone might have just said off work for 6 weeks. We're saying, off work for 3 days and then gradual return so that they're able to stay in the workplace for a more meaningful amount of time and they maintain their benefits, which can be really hard to do if you're out with an illness. So that's one of my projects that I'm proud of that I'm still working on at the University of Colorado. Here locally, I have a couple of different things going. We're working with a federally qualified health center that's in the Jackson area, just trying to increase their rates of colon cancer screening. They found that it was really a barrier to try to get their patients in for colonoscopy. And so what we're pilot testing is whether people are more likely to complete colon cancer screening if they use one of those Cologuards. Um, and so a Cologuard screening test is only good for 3 years, where the colonoscopy is typically good for 10. So the clinic would rather their patients do colon cancer screening with a colonoscopy, but if they can get 5 or 10 times as many people to complete the Cologuard, then it might be a worthwhile trade-off for them. So again, we're looking at the barriers. Some of that's the barriers of the referral, the electronic medical record, um, and really just the prohibitive cost for a patient who's otherwise not insured. If they have insurance, it's covered for free. But if they're not insured, it's not free. So that's another barrier for a lot of their patients. So trying to address those again in a systematic way to say, how can we improve the health of their patient population? So, yeah, but the big ones remain things like diabetes and high blood pressure and the related heart disease that goes along with that. And then, the obesity epidemic, the opioid epidemic, those are all things that people in my department are actively working on. And so, that I think is one of the ways we can really start to improve the health of the people in our region. One of the things I think matters most about preventive medicine is that it's one of the most cost effective types of medicine. So if you can really tell somebody how to appropriately eat right, lose weight by exercising, avoid harmful substances, get their sleep, avoid stress, things like that. Those are very, very low cost interventions. And so those are things that people can afford versus the old days where you told someone you need a CPAP machine and you need these 6 pills. Um, People just aren't going to be able to do that. And
Like,
so that's what took
like,
me 25 years to learn.
absolutely. And, as the years go on, people are more and more looking for that cost effective way to get in there and actually prevent it from happening in the first place. So there's just such a great need. So I think you're answering a lot of my questions before I'm asking them. That's amazing.
Excellent.
This is perfect. So let's see. Okay, so let's jump right into how medical students fit into all of this because, a lot of us, including myself, I'm not entirely sure if preventative medicine is going to be the residency route that I go. Who knows? It feels like it's chasing me around. But how can we, no matter what field we choose to go in, and just as medical students, I'm a third year now, how can we, let me see exactly what I wrote so I can make sure to say it correctly. But what is the most important thing that you believe right now medical students can be doing or be educated on to create, a better future for preventive health and public health?
Yeah, it's a great question. I wish I had an easy answer for you because the truth is, our system is still set up where physicians are reimbursed by doing clinical work, seeing patients in clinic, doing procedures, rounding in the hospital, that sort of thing. So, if you take a physician out of that environment and just try to plug them into the community, there's a lot of benefit there. But the question always is, well, who pays for that, right? And so, some forward thinking insurance companies will do that. I mean, it's easier in a closed system somewhere like Kaiser Permanente, where I worked when I was in Colorado. I worked for them for a while. The VA has a closed system. So a lot of times the VA is interested in prevention, but until there was ever a single payer system, you're going to sort of just rely on docs almost just out of the good of their heart going into the community and doing this kind of work. So I think to answer your first question about residency training, I agree. I mean, if someone had really told me, sat me down and told me what general preventive medicine was or what occupational and environmental medicine was as a medical student, I probably wouldn't have listened. And so it really kind of took me a while. And in fact, most people who train in those disciplines have trained in some other field before they come back to preventive medicine. Some people know in medical school, but most don't. And I think it's because of the challenge that you mentioned, which is the recognition of the discipline is pretty low. People don't know much about it. And then even if people do discover it, it seems interesting. But then the question is, well, how would I actually make a living doing this?
Yeah.
So some people do it as part of their job. Um, Certainly, if you're able to work in an academic setting or a government setting, that's one way. But a lot of our projects are grant funded, so you can write for grants and do the work and sort of pay yourself through the grant. But you're right; a lot of people are going to do it in addition to whatever else they do. So I would say, if you're interested in prevention and improving the health of your community, the best way to do that as a physician is to get involved with local politics and try to influence policymakers. And that often for physicians is sort of an icky proposition. You don't want to do that,
Yeah.
but it really is one of the best ways to improve the health of your community. If you don't want to get involved with politics directly, joining any number of medical societies or you know community groups, sometimes that's through people's place of worship, but it could certainly be any number of community organizations that really do um, put the patients in the community first and look at ways to solve their problems without prescribing medications, but doing things that are sort of, you would want to say common sense, but that it's not
Yeah.
enough, I guess. So I think the issue for students is they're often very, very enthusiastic when we tell them about the disciplines of occupational medicine and preventive medicine. But it seems like such a stretch, and it's easy to think, well, I can work as a family doctor or I can work as a pediatrician and I can still do those things in my community. And that is certainly true. Or you could be somebody like me who said, well, maybe I want to get a master's of public health and do that work in addition to the work I do as a clinician. And really that could be foundational in teaching you a lot of the ways that you can get involved in prevention and public health. There are many different varieties of a master of public health. And I found that mine was incredibly helpful. It was actually really fun to be a student again when I went back and did my classes. And then the other students in your class are often looking to you as the physician because you're the wise one who's been already through medical school and had a real life and worked in the clinical setting. And a lot of those students are really thirsty for that information. So that's another way to kind of spread the word about public health.
Yes, and one thing I've always learned about, or I've always heard about, if you weren't to go into preventative medicine as a physician, the medical students, we have so much more time. And right now, if you ask me, I don't feel like I have so much more time. But it kind of like it kinda lands a lot on the students to be making these. We're the new generations that are gonna be coming up, we're gonna be making new physicians, and so, as far like, for the SMA's sake, we teach physicians and medical students how they can get more involved with, different professions and different residencies, and then in the community as well, and so for medical students' sake, if you had any tips as far as what they could do to stay educated or outlets, would you recommend doing the same things that you recommend to the physicians, going into their own communities, just reaching out to local preventive health, their own schools, departments,
Right.
stuff like that?
Yeah, definitely. I mean, I think that, the public health, the trust in public health took a hit during COVID for sure.
Yeah.
And which to me was a shame because it was really should have been a great opportunity. I think, maybe not coincidentally, but has also just been a general decline in the access of services through the local health department. So a lot of people talk about when they were growing up that they just went to the health department to get all their shots, and that was just the normal place to go to get your childhood vaccines for school. That's where maybe where your mom went to find out about programs like WIC and things like that. And it seems like that has declined. So like the prominence of the local health department has declined. So again, it doesn't seem like for people it's such a prominent place to go and get health information, but it's also a place that maybe in the past people would have thought of as being a place to work. And I can tell you from working with people at the state level of health department, there definitely is a lot of ways to get involved through the health department at the county level or at the state level. There's been some reorganization at the health department in Mississippi over the last maybe 10 years, but I do think that that's a place for students to get involved because they need the manpower, and it would really help them out to have students that they can train and do some of the work. And I think that students would find that work incredibly engaging because it really is rewarding and you can make a significant difference in the health of your community. So that's a plug I would give. And like I said, I don't work for the health department and never
Yeah.
have, but I do think it's a place that that students could certainly get involved because they have so many projects going. You could it's a place you could drop in for a few months and make a real difference where a lot of times students want to get engaged, but just because of their schedules, you don't have time to work on a 3 or 4 year long research project. So that's one idea I have. And I would say, you didn't mention it, but I would say the Student Health Coalition that you're a member of, that you've helped put together at UMMC, I think that as an organization is fantastic because it's really teaching students to engage in the communities that they already come from. So, if you look at the medical school classes that have, increased in size since I was a student, that's certainly a good thing because it draws students from all over the state, all different backgrounds, allows those students to go back home, engage with members of their community through some of their community outlets to do things like health fairs where you're screening people for, just making sure that people are aware, like, hey, you should probably know what your blood pressure is and what that number means, what your blood sugar is, what your hemoglobin A1C is, and educating people because really I'm frequently astounded by what people don't know about their health and what types of things contribute to lots of the diseases that are so commonplace. So we clearly need an effort at educating people, meeting them where they are, which is really kind of where the roots of health literacy is. But um, being that local member of the community that recognizes someone that has a touchstone with the people that are already there, you're not seen as an outsider. You're not seen as someone who's coming in telling people what to do. You're there to kind of coach them. And I think that's what students are really good at, not only because they're enthusiastic, but because they're, maybe a little less jaded in a way, and they're still more enthusiastic, and they would certainly want to help people understand why those things are important for their health.
Absolutely. I thought it was interesting that you said med students really don't have the time or want to, do a 3-year research project or anything. So I think it's important, in this podcast to talk about that's not the only way. And so that's really awesome. Actually, the Student Health Coalition that we were talking about has a partnership with the Mississippi Department of Health, like you were saying, and they have, I'm pretty sure every southern state has the same situation as the Mississippi Department of Health does, but they'll have, monthly events where, just like you said, back in the old days, people would go to the health department. That's where they got things done. And so we'll go to the health department with them and help them screen and, give them their blood pressure, blood glucose, and everything. And so it doesn't have to be some sort of, I want to make this profound impact and I'm going to have this ginormous manuscript of 3 years to go off on, but it can be, sorry, we're running out of time, obviously. But it can be something in the community that doesn't have to have just a big research shaboom to it. And then also, just one more question. We have 10 more minutes, so I just want to get in. Let's see which one. So we talked a little about the Student Health Coalition. Me and one other classmate are co-presidents for it. We love it so much. And Dr. Williams is actually our faculty advisor for the Student Health Coalition. So that's how we've met, and we've been working with him. And he's been just really, really great for the organization, helping us get a lot of initiatives started. And we've been spitballing all kinds of fun ideas. And he's in the know with the preventive health department. I mean, with the preventive health. And so we just want to maybe talk a little bit about what the Student Health Coalition does. And then maybe if anybody watching ever wanted to start an initiative like this or get more involved with their health department in their state, this is just some ideas and stuff.
Sure.
Do you want to talk about the SHC, or you would, whatever you'd prefer?
Yeah, I mean, I'll just describe it briefly. I mean, you know as much about it as I do, but I would say to me, it was an honor. I actually took over for a member of our department who worked at University of Mississippi Medical Center for almost 30 years, um, Dr. Alan Penman. Dr. Penman started his life in the UK and through the National Health Service there and trained as an ophthalmologist. And he actually was deployed to parts of the world like South Africa and Jamaica that then were still parts of the British Commonwealth. And he got really interested in tropical eye diseases, and that led him to thinking more about prevention. And he saw so much need in some of the places that he went that he said, there's probably a better way. And so he actually did some additional training, and he did the Epidemic Intelligence Service through the CDC, where you basically go do disease outbreak investigations. And he chose to come to Mississippi because he knew it was a place where there was a lot of need.
That's incredible.
So,
Me and him have very similar stories. Y'all coming to Mississippi because there's a big need.
yeah, definitely. And so he is a colleague that I worked with for a couple of years, and he was nearing retirement age. And this was one of the things that I think he was proud of, is that he had collaborated with a student group that had sort of started from scratch and
Hmm.
decided to get involved with the community. There's a lot of medical schools have some version of a free clinic where students kind of go and get to learn how to really do clinical medicine in a one-on-one setting. But the Student Health Coalition is an attempt to take that model and really turn it into the public health version of a free clinic, where these are students who are getting involved in screening programs and education programs at the community level. And again, one of the things I realized in my training is that, you see someone in the hospital who's had a heart attack, and you say, oh, too bad they got here. If
Hmm.
only we could have stopped them from smoking. If only you could have, helped them lose weight or exercise more, and all the other risk factors. And so the farther back you go into that timeline, the more you realize we didn't start early enough. And so it's like, my mind changed to like, oh, if only we had gotten when they were sort of a middle-aged adult, or, oh, a young adult, oh, maybe a teenager. And now I realize like we need to go all the way back to like the preschool
Yeah.
level kids for education and also just for changing health habits, because those get ingrained really early. And so I think the Student Health Coalition is one of these places where taking young people, medical students, and even college students in some cases, and having them sort of do that educational intervention with kids who are elementary school or even before, and then playing off the kids with their parents, with their grandparents, because it really does, that level of intervention is often what's required to break these cycles of poverty and of bad health outcomes. So really, I think the earlier we intervene, the better. I know we're running out of time, but I would mention something. I heard a talk recently and I was fascinated by it.
Yes.
Um, and so I'll try to keep it vague because I don't know if this person would want me to share all of their study, but this was a person who basically investigated in a part of the world that had essentially been war torn for part of the 1990s and had extreme famine. And what they found was that the offspring of people who lived during that famine had significantly high rates of obesity,
Mm.
in a place where there really isn't the type of stuff that we would tend to blame on obesity in the United States. There's not sort of a quick stop on every corner. There's not a fast food restaurant, on every block. And so they were saying, well, how is it that a place that's notoriously poor and in fact went through this famine these years ago, how is there so much obesity in the community? And essentially what they've kind of come to learn is that that stress of that extreme famine and food insecurity that those people had during those war years did something to basically program those kids, whether it's genetic or epigenetic, and it essentially turned on this protective mechanism that said, "Oh, I know how to not starve to death. I'm just going to be obese for my entire adult life."
Wow.
It's not hard to see the parallels to the poor places in the South that had the same types of things. I mean, we had food insecurity, not driven by famine, but driven by high calorie, low nutrient food that's widely available and incredibly cheap. And so, people aren't in a true starvation state, but in some ways they are starving for good food. And
Yeah.
I think one of the biggest lessons I've learned in prevention is that, the healthy choice has to be the easy choice. And so if you realize that people are literally programmed from the time they're in the womb for how their health outcomes are going to be throughout their life, there's not a moment to lose, basically. So the sooner we can intervene at the population level, the better.
This is incredible. What a great way to end the podcast and everything. I can't thank you enough. This has been so educational, and I'm hoping that if anyone's out there watching or anything and you would like to get a hold of us or anything, just let us know. Feel free to also reach out if you would love to learn more about the SHC at shcofms in Gmail. And we can just talk about this all day. We can bring Dr. Williams in on the email. We would love to talk more about
Definitely.
this. This is his life. He loves it so much, and it's just been such an inspiring thing to work with him. Dr. Williams, thank you so much again. Do you have anything else that you'd like to add or anything?
No, just say thanks, Grace. I mean, it's enthusiasm like yours and the people that you're partnering with through the organization that I'm fortunate enough to work with. Like I said, stepping into Dr. Penman's shoes and hopefully contributing to the legacy that he left at our medical center and the organization that you work for and with. I'm just proud to be a part of it. And yeah, I'm happy to talk about this. I'm sorry that we only had 30 years or so
Yeah.
minutes. We could go on and on. But I
Yes.
appreciate your enthusiasm and thank you for inviting me to join you.
Well, thank you so much. And the SMA, thanks you guys so much. And have a great rest of your day.
Thanks, Grace.